All right. So what we're going to talk about today is pretty simple, pretty straightforward, okay, at least on the surface. We're going to talk about that it is potentially dangerous for you to exercise, right? Which may seem, in light of this crazy thing that I keep showing you guys over and over again, right? Being more active, better, reduces all-cause mortality. Being more fit, so I'm active at an intensity high enough to change VO2 max, make VO2 max go up, right? Reduces my relative risk of all-cause mortality significantly. We've spent all of class up until now yelling at you guys, right? Exercise good, exercise good. If you do more, you've got a less chance of dying from anything, which is great. But then today, I'm going to present you with some somewhat ironic information, okay? Every time that you go to exercise, okay, if I ask Haley to stand up and start doing jumping jacks, which I won't, okay? If we ask Haley to do jumping jacks, we better have Mitchell ready to make sure and perform CPR, just in case she has some sort of cardiovascular event during all of this, okay? Every time you exercise, in comparison to resting, you dramatically increase your risk of having a heart attack, okay? Or some similar type of cardiovascular event, okay? So in that particular way, exercise is dangerous, okay? It's dangerous. Now, the question you need to be asking is, well, Dr. Black, don't we all exercise all the time? It's not so dangerous that we do anything that says, well, maybe we shouldn't do it. We know there's all these benefits, but there's this kind of cost-benefit ratio. And so when I say that exercise is dangerous, what I mean is, compared to sleeping, you get this dramatic increase, okay, in what's going to happen in your chances of these things. But it's still such a tiny, 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 infinitesimally small chance that for the most part, we just say, screw it, who cares, let's go, okay? And so, right, in general, exercise good. In general, more tends to be better. Vigorous exercise, though, does have certain risks, okay? You can have sudden cardiac arrest. You can have a heart attack or a myocardial infarction. And most of this, okay, your chances of having these two things are probably due to either having a diagnosed or what we would call a silent, which is undiagnosed, form of cardiovascular disease, okay? So today we're going to talk about not so much the whys of this risk. We're going to talk about how do we mitigate that risk. We'll get into some of the why and things starting on Wednesday when we start talking about cardiovascular disease, okay? Statistics would tell us that every time you go to do vigorous exercise, about 1 in every 700,000 times that you ladies of your age go to exercise, there's going to be one cardiovascular event, okay? Guys, we're at a much higher risk, about 1 in every 350,000, okay? Somewhere in that range, okay? You get to be my age, and those numbers continue to go up, okay? You get to be my age, and they're even higher, about 1 in every 10,000 or something like that, okay? That's a great question, Zach. Mostly it is estimating how many times we think people exercise and like how many actual heart attacks there are per like sort of age range. I mean, it's not like I just follow all of you guys for years and years and I ask you if you've had those, but some of that is going to come from, some of it comes from the National Health and Nutrition Survey data where we ask people if they've had a heart attack and these things. We ask them how many times they've been active in the last 30 days, and there's some questions that let us get at all of that. I mean, it's not an exact thing, right? But the data would be suggestive to me that I've probably seen and been around several thousand exercise sessions or VO2 max sessions, if we want to call it, all of that in my time, in my almost 20 years of doing this, I'm probably due for somebody to have a cardiovascular event. Okay? But of course, that's not how the odds work, right? It's we take Tessa, and she has like a 1 in every 700,000. That's what her thing is. Every time she goes, it's 1 in 700,000. Okay? It's not like that it's going to magically sort of go up every time. Like, well, she's gone, and Lindsay has gone, and Hallie has gone, and Kelly has gone, and so we've kind of increased. It's that every time it's about like that. Okay? It's called the Better's fallacy on some of these things. But this is what's going on. Okay? So, what do we do about that? Right? What do we do about that? Well, we need to ask people questions prior to having them exercise to determine what are your chances, okay, of having sudden cardiac arrest, of having a myocardial infarction, okay? And obviously, if this sort of cardiovascular disease is the thing that most likely puts us at risk for either of these two things happening, then one of the things that we can do is just ask you, hey, Camilla, do you have cardiovascular disease? You don't have to answer, that's HIPAA protected information, right? But I can just say, do you have cardiovascular disease? And you're going to say, no, I don't have that. I'm like, okay, we're already like halfway there on trying to make sure that it's going to be safe, okay? So this is just a cartoon trying to sort of demonstrate that, especially in older athletes, especially in people like your grandparents' age and those kinds of things, right? That we've got this sort of tipping point that regular exercise is good for us, but every time we go, okay, every time we go to exercise, because exercising increases the work of the heart. Blood pressure goes up, heart rate goes up, stroke volume goes up, so cardiac output goes up. That means the heart has to work harder when we have you exercise. It's that extra work of the heart in combination, okay, with sort of things that may be going on in your blood vessels, in the heart itself, okay, some other kinds of rare disorders if people have valve issues and those things. It's the increase with exercise that tends to make these underlying problems manifest themselves and become riskier, okay? We'll talk a lot about on Wednesday something called atherosclerosis, where you get fatty depositions of plaques, especially in your coronary arteries. And what happens is I exercise, blood pressure goes up, work with the heart goes up. I have a hard time getting blood through my coronary arteries because, okay, I got to send more blood to the heart because it's working harder, and then I'm going to have problems. So we're trying to kind of balance all of this stuff out, right? We know that it's good. We're going to get this kind of reduction in mortality rates and those kinds of things. And so what we want to do to try to mitigate risk, some of it we can do with how we program, gradually increase exercise, right? We can give people aspirin and stuff if they need to be on a blood thinner or a blood pressure medication, which we'll talk about probably next week. But the other piece is what we're going to go through today, is if we know that certain things are going to lead to this transient increase in sort of coronary artery disease risk, or that if you have coronary artery disease, you're going to get this transient increase in having a myocardial infarction, we need to ask people questions. Okay? Do you have this? If you say, no, I don't have this, then we need to look a little bit deeper, though, and figure out, are there other things that might be predictive of you having it, but you not knowing that you have it? So that's what we're going to go through today. Okay? So we're going to figure out how we do all of these things. So I'm going to ask you guys a question on the test. Okay? I chuckled when I read your course assessments, okay, when people say, like, you know, what could I do better? And people, I think, sometimes humorously, sometimes not so, you're being very serious. Just tell us what's going to be on the test, right? You guys would do better if I would just tell you, okay? Which is fine. I can appreciate all of that, right? I want to try to make sure that my teaching and emphasis matches up with the study guide, which matches up with what I asked you about. And I hope do a pretty good job. But here is one. This will be a test question on test number 2. Who do we need to screen for cardiovascular disease risk prior to beginning an exercise program? Who should we screen? And the answer is everyone, okay? Everyone. There are no exceptions. I don't care if you're an Olympic athlete, or I don't care if you're a person that's been bedridden for 10 years. I don't care what your blood pressure is. I don't care what your health history is. We screen everyone, okay? Absolutely everyone, no exceptions, okay? We need to know, no matter how healthy or unhealthy we think you are, we need to know and have the answer to these questions, okay? So what we're going to do, right, is we're going to try and identify people that have an increased risk of having an MI or cardiac arrest prior to beginning exercise, so we screen everyone. We're going to do this by asking people to fill out some questionnaires. We'll talk about those questionnaires today, okay? We'll talk about how we interpret the answers to those questionnaires today. And then for Wednesday, those questionnaires are on Canvas. You're going to take said questionnaires and have some of your friends fill them out. And then you're going to look at their answers and try to decide who is it safe for us to exercise and why. Okay? So we do these questionnaires first. Based upon what we figure out from the questionnaires, we may or may not need you to go and get physician's clearance to do exercise. I'm going to be 100% honest. Outside of people that are cardiologists, most kind of general practitioner MDs know less about the risk of exercise than you guys will when we finish class today, okay? They're just not trained in this. It's not their fault. It's not that they're not well-intentioned. They just aren't trained in exercise and some of the risks that are associated. Cardiologists very much are, okay? So based upon your answers, we may send you to see a physician and get a physician to sign off on things. And then the physician may want to have you perform what we would call a stress test, which is in essence an exercise test with an EKG on. We're going to do a VO2 max test on you with an EKG, and they're going to watch as they make the heart work harder and harder. Are there going to be arrhythmias or things that would show that you're at this heightened risk of having sudden cardiac arrest? Okay? You've had a heart attack, or they think you're at risk of having a heart attack. They basically try to exercise you to see if they can cause one, to see how sort of at risk you're going to be. So we'll talk about what the answers to the questions are that would trigger either of these two kinds of things, and then we'll talk about kind of what the results of this might lead us to tell us that you should or should not do. Okay? All right. So we are going to be looking for a little bit of initial information. Okay? When we do a health appraisal or a health screening, we want to very much start off by identifying medical problems. Okay? Do you have, especially from a cardiac perspective, do you have medical problems that could be made worse by exercise? Have you had a heart attack? Have you had a stroke? Do you have high blood pressure? Okay? Do you know for some reason that you have a valvular disease or something of that nature? Okay? So, are there medical problems? These are the easy ones. You got a medical problem, you got to go to your doctor, you got to see a cardiologist, they'll clear you, okay? Or not clear you. We're going to send you off to them. Let's say for some reason, though, you say, no, I don't have, as far as I know, a medical issue, okay? Mitchell does not think he has valvular disease. Okay, great. But he may also, especially people that are y'all's age, have never had cause to go to the doctor to get those things checked. So just because someone says, no, I don't have these, we want to probe a little bit deeper, okay? So next, we're going to ask, like, do you have the problem? Then we're going to ask, are there characteristics, okay, things like a family history of cardiovascular disease that might increase the risk of you having health problems. Are there characteristics about you? Are there things that we call signs and symptoms that we may be able to ask you about while you're doing exercise, or something that would be predictive that, yes, you do actually have something that may be wrong, but it hasn't been diagnosed yet, right? So things like a family history. If your mother or father has had a heart attack or a sudden cardiac arrest before a certain age, which we'll talk about, you are genetically at an increased risk of having the same problem, okay? We'll kind of get into those numbers, but that's the kind of stuff that we're looking at. You'll also ask about things that are called, as I said, signs and symptoms that would be indicative that there is a medical problem that has yet to be diagnosed, okay? A sign or symptom is something that we can see, something that you can feel, something that we can measure, okay? We ask Lindsay to get up, we ask her to run for us for a little while, and we say, Lindsay, how do you feel? Do your feet hurt? Do you have numbness anywhere? Okay? Are you dizzy? Are you short of breath? The short of breath one gets to be tricky, right? Because if I ask her to run as far as she can, as fast as she can, she may get dizzy. And it may not be a sign of anything that's actually wrong, okay? But if you stand up and you get dizzy, if you're walking and you feel dizzy, those can be very clear signs that you've got an issue regulating blood pressure and maintaining blood pressure to the brain and those kinds of things. And so we're going to ask about those. We'll dig into on the actual questionnaire kind of what the actual signs and symptoms, what the words we want to use with people are going to be. Okay? So most people that are y'all's age aren't going to have a diagnosed medical problem. Lots of people probably aren't going to have any kind of family history. Many of you guys are probably not going to have signs and symptoms. If you've had signs and symptoms, that tends to drive people to go seek a medical diagnosis, but you never know sometimes. So the last thing that we're going to want to do is look at lifestyle behaviors. Are there things that you guys do? Smoking, for instance, okay? Being sedentary. Are there lifestyle things, or are there other things we can measure, like your blood pressure, your blood lipids, okay, your LDL cholesterol levels? You can measure your fasting blood glucose, okay? There's some things like that that are going to be predictive of. If you exceed or are below certain values on those, they're predictive that you may have atherosclerosis and therefore might be at an increased risk of having sudden cardiac arrest. Okay? So we'll work our way through all of those as well. And then once we've done all of these and we decide that potentially it's safe to have you exercise, right? Or if they think there may be a medical problem, we want to get it on an EKG, then we can do a fitness test and we can see. Your VO2 max is below something, you need to kind of exercise in this way. Your EKG showed this, we need to do that. Okay? Are you guys with me so far? Okay. I will ask, Hallie, who are we going to screen? Everybody, yes, okay? Write that down, it will be on the test. It'll be on your final too. So it's really important, okay? It's really important. All right, so this kind of a thing here, this sort of mnemonic device that I did not come up with, that I totally stole from a previous course that I had called Mr. Please, is a reasonable way to try to understand when we take someone's kind of medical history and health history, what we're trying to achieve if we want to apply it to prescribing exercise to a person, okay? If you really care about a lot of this stuff, take exercise testing and prescription. So this is where I took it from. This from Dr. Larson's class. But so we will ask people, right? We'll get a medical history review. We'll do a risk factor assessment, like are you sedentary, are you a smoker, etc. We'll ask about prescribed medications. We'll ask about your level of physical activity. We'll use these kind of information from these first four to establish, right, do we need physician's consent to have you perform exercise? If we decide no, we don't, or if we do, but then you have obtained that, Then we do our fitness test, like a 1 rep max or a VO2 max test. Then we do your exercise prescription using FIT and PROS, and then we can evaluate with our follow-up test with a follow-up 1 RM and a follow-up VO2 max test. Okay, so what we're really going to worry about for our purposes for this particular test is going to be these first 5 things. Okay, obtaining medical history and risk factors, figuring out then if we need physician's consent or not, and then making some decisions from there. Okay, I'm going to show you guys 2 forms. These are not the world's most thorough forms. If you take testing and prescription, you'll use a different form, and you'll get an even more detailed way of doing screening. But for our purposes for class, this is a good place to start. Okay, I'm going to show you, and this is what is posted on Canvas, are these 2 forms. Something called the PAR-Q, which stands for the Physical Activity Readiness Questionnaire. And then there is a Health Screening Questionnaire, or the HSQ, which has been put together jointly by the American Heart Association and the American College of Sports Medicine. Okay? We will make a note here. The PAR-Q is good and useful if people want to perform light and moderate intensity exercise. Light and moderate intensity exercise. Okay? So, Kate, if you pass the PAR-Q and it says you're okay, what kind of exercise, like an actual thing, do you think you could do, but what might you not be able to do?
I would think you could do certain lab testing things,
Okay.
but not, maybe not as an extreme of ones.
Okay.
So like when we're talking about putting like a mask on and running, maybe not like that, but maybe you could get on a bike and ride bikes. Or...
Okay, it seems like a reasonable thing. Okay. Kate's very close on all of that. Lindsay, you think you can help him out? If you take the PAR-Q and you pass the PAR-Q, you can do light and moderate. Could we put you on a treadmill and ask you to run? Maybe. Okay, can you expand? You say maybe, like under what circumstances do you think we might be able to? Okay. How fast could they run for it to be light or moderate intensity exercise? A light jog, okay? A very, very light jog, okay? So you all see the point that I'm kind of trying to make. So Kate and Lindsay are we're right in that gray area on those things. But the PAR-Q is useful for light and moderate intensity activity. So to be safe, okay, if you pass the PAR-Q, you can walk. You can do you can do a walking program. If you're very, very fit and you pass the PAR-Q, maybe light jogging is not going to be enough of a MET value to get you into the vigorous. But for most people, okay, the PAR-Q is useful for walking. Maybe like spin class on like setting number 1 or something. You're not going to CrossFit with the PAR-Q. Okay? I promise you. That's not, no. Okay? Absolutely not. So keep that in mind. It's a very simple questionnaire. If you want to go work out at the Huff, they make you fill one out. Okay? They make you fill one out. They don't take any additional information. They should. They really, really should. We've not pointed that out probably forcefully enough to our legal department, but we probably need to. Okay, so it's good for this. PAR-Q is generally good. Like if you've got older people that are sedentary, you just want to know, like, can we have them start doing some walking stuff? Great. Okay. For everything else, we want to do vigorous intensity activities. We want to jog. We want to go to CrossFit. We want to go to Orange Theory or wherever else it is that you guys go. You want to go to Steel and do some deadlifts and power cleans with the muscle bros or whatever it was that you guys were calling them in your test evaluation. You're going to want to fill out this health screening questionnaire. Much, much, much more detailed information provided from that, making it much easier for us to decide, is it safe, okay, to have you do these higher intensity. All right? We are going to, from both of these things, although we get a much clearer picture from the screening questionnaire, get some information about your medical history, okay? Do you have a particular condition that can make this risky? We're going to ask about current medical conditions, right? Maybe you had something, that's medical history. Do you have something right now? We'll ask about signs and symptoms. We'll ask about risk factors, and we'll ask about medications, okay? We're not going to get into every medication that people can be taking, okay? I can tell you we do this if you want to come do research in our lab. We take these much more detailed screening questionnaires and kind of medical histories. There's so much stuff that's relatively common that college age or kind of normal people will take from a prescription standpoint that we can't cover everything. Okay, but we'll talk about kind of a few of the ones that might pop a red flag. Okay? All right, so things to keep in mind. All of the information that we gather from the Part Q and from the health screening questionnaire is considered protected health information. This is stuff that's protected by HIPAA, right? Protected by HIPAA. So if you were going to ask people to fill these things out, you're going to collect this data. Depending upon where you work and what you're doing, there's going to be a requirement to be trained in HIPAA compliance. The basic take-home from HIPAA is people answer this, you can't tell people what they say. Okay? They're going to tell you something about their medical conditions. Height and weight is protected health information. How physically active you are is protected health information. Okay? So we can't run off and do those things. If Helen tells us how active she is, we can't run around and tell her roommate or her friends or some random stranger, you know what? She runs 3 days a week. Okay? Good or bad, it's protected information. So just keep that in mind. So when I have you guys ask friends or roommates to fill out these questionnaires to bring to class on Wednesday, no names, okay? They are not to put their name on it. They're not to really, they can put their age, but that's it. Just like put your age and your sex, and that's going to be it, and then fill out the rest of it, okay? In theory, they can fill that out and then give it to you, and then you can't tell people what else is on there. But that way, if we pass them around in class and swap them around and see if people actually did correctly identify if they were high risk or moderate risk or low risk, all we have is just information that can't be linked back to. Okay? Fitness test results are also personal health information. Your 1RM, your VO2 max, protected health information. Basically, everything is protected health information. Okay? If we learn something, don't share. All right, a little bit of history about the Part Q. It's Canadian, was developed in the 1970s. The one I'm going to show you is the version that was revised in 1994. It's pretty straightforward. They've actually revised it twice since then. It asks the same questions in a slightly different manner, but we kind of get at the same kind of a thing. You can use pretty much any of them, okay? It is safe for low to moderate, so stuff that's basically under 60% of VO2 reserve. So for most people, that's going to be brisk walking. If you start to jog, we're probably going to get close to this, so we just really want to be very, very safe, okay? It asks a series of yes, no questions. If you answer yes to any of them, you do not pass. Okay? It's like Monopoly. You don't pass, you say yes, you don't pass go, you don't get $200. If you answer yes, you need to go to your doctor, and we need to get physician's clearance for them to exercise. Okay? So, here's what the kind of 1994 version looks like, right? There are 7 questions. You answer yes or no to those, and then it tells you kind of what all to do. The most up-to-date one has like 11 questions, but it is basically these same questions. They've just split them into a couple of a little additional clarifying things on all of this. Like question 5, where it says, do you have a bone or a joint problem that could be made worse by exercising? The newest one actually asks for a little bit of additional information there that's going to be helpful. Okay, so if you say yes, go to your doctor. Very, very simple. You're not safe to exercise in our mind yet. Okay? If you answer no to all of them, then we can have you do light to moderate intensity activities. Okay? Having a person fill out and pass the Part Q, please write this down, is not sufficient. It is not sufficient clearance to do exercise testing on people. Okay? When we have a normal semester and we test 1 rep max, and we test VO2 max by having people go to 80% of heart rate reserve and estimate things, okay? Filling out the Part Q is not going to give us a sufficient amount of information to know if it's safe to have you guys do, okay? So for the most part, this is not enough for us to do kind of normal, regular exercise testing. Okay? This is really going to ask very, very simple questions. Because a doctor said you had a heart condition and that you should only exercise in a way that they recommend. Okay? Have you only done it? Do you feel chest in your pain, or do you feel pain in your chest? Yes, I feel chest in my pain. That's how my day is going. Do you feel pain in your chest when you do physical activity? And this is not, it's Monday, I'm bench pressing, and I feel pain in my chest because I'm bench pressing, or I dropped the weights on myself, right? This is very specifically angina pain. This is pain as a result of a lack of blood flow to the heart, and so it radiates. It tends to be sort of left shoulder, upper left arm, kind of over here type of pain, okay? That's what they're asking about. In the past month, have you had chest pain when you were not doing physical activity? This is worse, okay? Some people, the ischemia to their heart is exacerbated and only occurs when the heart has to work harder like during exercise. If you get ischemia and get angina pain at rest, you are a ticking time bomb about to have a heart attack, right? And so either of these things, you need to go to your doctor and get checked out. Especially number 3, we probably need to do bypass surgery on you like immediately, okay? Do you lose your balance because of dizziness, or do you ever lose consciousness, okay? This is under normal, non-medicated, I'm taking drugs or I'm drinking alcohol or other kinds of situations, okay? Although not great if it's in those situations either, but this is just, do you ever become dizzy or lose consciousness just under normal circumstances, okay? Again, this would be indicative of lack of blood flow to the brain, okay? Which is very, very good. You have a bone or joint problem that could be made worse by a change in physical activity. In folks that are y'all's age, we see lots of, I tore my ACL in high school and I had it fixed and I've been cleared to do whatever I want now. We get a lot of that. That's not what this question, that's why they've changed it to kind of further clarify, okay? It is, have you been told by a doctor that you cannot undertake certain activities because of a previous injury in a particular joint? That's what we're really trying to get at here, okay? And so in people that are y'all's age, we see lots of knees or ankles or shoulders or things, but we see very, very few that actually would qualify as a yes here. Is your doctor currently prescribing drugs for blood pressure or heart condition? Okay? Are you taking water pills or a beta blocker or an ACE inhibitor or something like that? Okay? So the blood pressure ones, especially in older adults, are really, really common. Okay? And for the most part, older adults or anybody on a blood pressure medication, it's not dangerous for them to exercise, but we want to just get clearance to their physician to make sure that accuracy. Okay. And then, do you know of any other reason why you should not do physical activity? What this question should really say is, are there any other reasons that doing physical activity might be considered harmful to you? I don't want to do physical activity because it sucks. I do not enjoy it. That's not a reason enough to put yes here. Okay? So if you put no on all of these, we are good to go for a walking program. So these questions are asking about, do you have a disease? Do you have signs and symptoms? Or do you have, or you can take any medication for a particular disease? Okay? We will come back to that the screening questionnaire, the health screening questionnaire gets us this information, in even more depth, plus some additional information. And it's this lack of some other things that means we cannot be certain that, right, even if you pass this, that it's safe to undertake vigorous intensity dysplasia. Okay? All right. Let us, now we'll go till about 8. We'll take that. So this next part is where things become trickier. Okay? This is where it's going to get trickier. What we're going to do using the health screening questionnaire is we're going to undertake what we would call a risk stratification. And to do this risk stratification, we're going to have an algorithm. Okay? An algorithm is basically just a decision tree. If you report this, here's the decision that we make. If you don't report this, but you report something else, and it's these two things, then this is the decision that we make. If you report none of these things, here's the decision, okay? And so when we do an ACSM or American Heart Risk Stratification, we're going to group people into 3 buckets, okay? Low risk, moderate risk, and high risk, okay? 3 buckets. Each of those buckets carries with it its own set of requirements of what a person can do from an exercise standpoint, especially from an intensity standpoint, and their need to get physician's clearance. Okay? So what we're going to basically go through is, here are the questions on the stratification form. We answer this, that makes us this. If we answer something else, then that puts us into a different place. Okay? So we are going to get medical history review from this. We're going to get information about diseases. We're going to get information about signs and symptoms. But most importantly, we're going to get information about risk factors. Okay? In people that do not have signs or symptoms or a disease, they would very likely pass the PAR-Q, and we would think that it would be okay for them to exercise. Okay? So what that's going to get us, though, with this additional screening questionnaire is helping us to separate, are you a low-risk person or are you a moderate-risk person? Okay? And at the low versus moderate, there's going to be, we can do some things but not others, and for certain things you need to go see a doctor, for others you don't. Okay? That's going to be the extra layer of complexity that we're going to get from this screening questionnaire and from our decision tree. Okay? Are you guys with me so far? Okay? All right. So what are we going to ask, and then what's going to put us into these individual things? Okay? So on the questionnaire, it's going to ask you questions first and foremost about, do you have some sort of major chronic disease? Do you have cardiovascular disease? Do you have a pulmonary disease, or do you have a metabolic disease, especially diabetes? Okay? So do you have CVD? Do you have asthma? Do you have chronic obstructive pulmonary disorder? Do you have emphysema, something with your lungs? Okay? So basically heart, lungs, metabolism. Really what we're worried about with metabolism most of the time is diabetes. Okay? If you have any of these, you are high risk, done. Go to your doctor. No exercise for you today, go to your doctor. Okay? If you have a major disease, you're done. Okay? Go to the doctor. High risk. Okay? Let's say you don't have one of those. Then we're going to ask about symptoms and signs that would be suggestive of, very suggestive that you have one of these 3 sort of underlying disorders. Okay? So we're going to ask about angina with exertion, so chest pain. Okay? Chest pain with exertion, unusual shortness of breath at any time, which might be indicative of a pulmonary disorder. Dizziness, or what is sometimes called syncope, which can be fainting or dizziness. Okay? Heart palpitations, which is oftentimes called tachycardia. That's the kind of official clinical term. If you have tachycardia or some sort of irregular heart rhythm. I had a heart murmur when I was born. I've never had a heart murmur since then, but I have to write it on every questionnaire that I have. Okay? That would be something that would be considered an irregular heart rhythm. Okay? We will occasionally get somebody in that's y'all's age, somebody in class that has one of these things. Okay? Usually not a big deal, but we're going to want physician's clearance. Unexplained ankle edema or swelling, and then something called intermittent claudication. Intermittent claudication is pain in your feet or your lower limbs. Okay, really anything below the knee. Feet, calves, TA, something like that. It's pain on exertion that tends to go away. That's why it's intermittent, okay, when you stop. This is a sign that you have something called peripheral arterial or peripheral vascular disease. Okay? And it can be very, very dangerous. Unexplained ankle edema could in some ways be indicative of poor venous return to the heart. Okay? And that can be indicative of congestive heart failure and a host of things, but it needs to be unexplained. This is not, I sprained my ankle, therefore it's swelling. Okay? This is not, I'm pregnant, therefore my ankles are swollen, although they very likely will, ladies, I'm sorry. Okay? It's more of an unexplained kind of a deal, because what this tells us is that we're sort of getting too much fluid on the venous side of things, and that's probably indicative of some sort of cardiovascular impairment. Okay? All right. If you have any of these, you are considered high risk. We have to ask you to go get physician's clearance before you exercise. Okay? So if you have a diagnosed disorder or you have any signs or symptoms, you are high risk. That's it. Stop. No exercise for you. Go to your doctor. We need to get physician's clearance. Okay? In some ways, that's the easy part of this. Okay? Known disease or signs and symptoms, done. Okay? All right. So for the next part, let's take a break, and then we'll pick up the next part where we talk about these behavioral risk factors that are going to have to make a decision between low risk and moderate risk. And then we'll finish class off with some examples that I'm going to have you guys do, okay? And you all will try to decide, is a person high risk, are they low risk, how are we going to do this, okay? All right, so it's 11:58. Let's come back at 12:05. 12:05. All right, so Zoomers, hang in there with me. We're going to have about, I don't know, 5 or maybe 10 minutes of lecture, and then we're going to do a class activity. I'm going to put you guys into breakout rooms. You're going to work with us just like as if you were in class. Today's just going to work really, really well. For that. All right, so y'all hang in there with me on all of this. Okay, so we've determined you do not have metabolic pulmonary cardiovascular disease. You do not have major signs and symptoms of metabolic pulmonary or cardiovascular disease. Good. You are not, as far as we can tell, a high-risk person. Okay? You are now in the ballpark of maybe being able to go and exercise today with us watching you. You want to go exercise on your own, that's fine. I don't care. I'm worried about cover my own ass. If I'm leading you in an exercise thing or watching you and you have a heart attack on my watch, I want to be sure I've done my due diligence. Okay? So, you don't have those. Now we need to identify what we're going to call cardiovascular disease or coronary artery disease risk factors. And if you have enough of these, we're going to call you a moderate risk person. And if you have a low enough number of these, we're going to call you a low risk person. If you are low risk, you can go do anything you want today. I can have you do a max test. You can do vigorous exercise. You can do any kind of testing we want if you're low risk. That's fine. If you're a moderate risk, it is basically like passing the PAR-Q. Okay? A moderate risk person can do light and moderate intensity activities without physician's clearance. but we can't do any kind of actual like max testing. We can't test their VO2 max. We really shouldn't test their 1 rep max or anything without physician's clearance. Okay? So what you see here, these are from the American Heart Association and from the American College of Sports Medicine. These are cardiovascular, specifically coronary artery disease risk factors and their associated threshold values. I'm sorry to ask you to do this, but you need to memorize this, okay? You will need to know all of these things and the associated numbers for the test, okay? I apologize in advance. You can curse me loudly or under your breath, but you're going to just have to know these things, okay? So the first thing we're going to do, right, is we're going to look at a person's age. Age is its own place in our decision tree, okay? Age is its own thing. If we have men that are 45 years of age or over, okay? If you're 45 or over, it doesn't matter what else is on our sheet here. It doesn't matter how otherwise healthy you are. If you're 45 or over, we need physician's clearance to do vigorous intensity activity and to do exercise testing, okay? Men 45 or over are moderate risk. That's it, we're done, okay? Women, the age range goes up. Ladies, you all have significantly reduced risk of cardiovascular disease compared to men, at least if we look at things at the same age, okay? So ladies, if you all are 55 or over, you're considered a moderate risk, okay? It doesn't matter if you have any of the other risk factors or not. So age is its own decision tree, okay? Men 45 and over, women 55 and over, you're moderate risk, okay? So you can do light and moderate, but anything else, you got to have physician's clearance. Assuming you have men under 45 and women under 55, then we're going to consult, okay, on these next 7 risk factors, okay? They're going to involve family history, cigarette smoking, okay? And I'm sure at some point in the very near future, we're going to add vaping to this, okay? So family history, smoking, how active you are. We're really interested in if you are sedentary, whether you are obese or not by BMI, whether you have high blood pressure, whether you have elevated LDL or total cholesterol in your blood, and whether or not you are what we would term a pre-diabetic, so a person that would have impaired fasting glucose, okay? Don't worry about this thing at the bottom. Don't worry about a negative risk factor of having high HDL cholesterol. We'll deal with this later on, okay? So let's look at it. We'll walk through each of these 7, and I'll tell you guys kind of how we've arrived at the cut point numbers that we have. So if you have a family history, okay, which means you have a first-degree blood relative, mom, dad, brother, sister, okay? First-degree blood relative. If you have a male first-degree blood relative, okay, that had a heart attack, had to have bypass surgery or revascularization, or died of sudden cardiac arrest before the age of 55. Please don't confuse this number with the age of the person that we are screening from the previous question, okay? So family history is male under 55 or female under 65 that have had some kind of cardiovascular event, okay? What we're going to do with these 7, I probably should have started with this. With these 7 is, it's either a yes or a no answer on these things. You either have the risk factor or you don't. And we're going to add up the number of risk factors that we have, okay? So those are our age ranges to qualify as family history, right? Cigarette smoking. If you are a current smoker, or you quit within the previous 6 months, or if you are environmentally exposed, so you live with someone that smokes indoors. Okay? You are a current smoker. Now, your question to me is going to be, Dr. Black, how many cigarettes do I have to smoke to be considered a current smoker? One school of thought is if you smoke any ever, you're a smoker. I think what they're really looking at is it ends up being like there's some number for the week, basically. It's like if you smoke more than it's like 4 or 5 cigarettes a day, right? So if you're at like 30 or 35 or something in a week, then you're considered to be a smoker. So there is a number, but it's really pretty low. Okay. So if you are an occasional cigarette smoker, and by occasional I mean I'm a social smoker, like I only smoke if I've gone to an event and I'm outside and maybe I've had a drink or something and I smoke like 1/2 of one cigarette and I do it very poorly. I may or may not be speaking from experience on any of this. Then you're not a smoker, okay? People know if they're smokers. People know, okay? So if you're a smoker, that's a risk factor, okay? Being sedentary is a risk factor. And so by being sedentary, this is not simply I don't meet the physical activity guidelines. This is an even lower amount than that, okay? Not participating in 30 minutes of moderate intensity activity on at least 3 days per week for 3 months, okay? So 90 minutes a week or less for 3 months. That makes you sedentary. So being sedentary is a risk factor. If you are obese by BMI, so your BMI is greater than or equal to 30. So if we know height and weight, we can calculate BMI, all right? So if you're obese by BMI, that's a risk factor. Weirdly enough, and in some ways it's actually an even better predictor, okay? If we have men who have a waist circumference or a waist girth of 40 inches or greater, this is not exactly is your waist size on your pants of 40 or greater. This is actually measured around where your belly button is. We'll do this as part of our body comp lab. Men at 40, women at 35, okay? That's the risk factor. That's even better. We know your BMI and your waist circumference. We can do a really nice job of predicting cardiovascular disease risk and type 2 diabetes. Because the waist girth is really going to account for visceral adiposity, okay? For visceral adiposity, which is the big risk factor. Hypertension. If you have a systolic blood pressure greater than or equal to 140, or a diastolic pressure greater than or equal to 90, that's considered hypertensive, okay? Now, under ideal circumstances, you have to have that measured on multiple occasions while you've been resting and all of that, okay? I can't just slap the blood pressure cuff on Camilla right now and test her blood pressure and decide if she's hypertensive, okay? There's some protocols that we need. But it's one or the other. It does not have to be both, okay? Either systolic or diastolic. That's a risk factor. So these are pretty straightforward. The last two are tricky, okay? Mostly because people don't very often get these things measured. But when we're looking at cholesterol levels, okay? If you have a total blood cholesterol level, okay? A total level over 200 millimeters per deciliter, okay? If you have an LDL level over 130 or an HDL under 40, that's considered a risk factor. You are considered to have what we call dyslipidemia, okay? Dyslipidemia, commonly just called elevated cholesterol. Remember, LDL is the bad cholesterol. HDL is the quote-unquote good cholesterol. It is better to use the LDL levels and the HDL levels than your total level, okay? That's where things are going to get a little tricky. Anybody in here know, Anybody on Zoom, does anybody know your blood cholesterol levels? Okay? Nobody knows. I can, with a finger stick and a very cheap assay, which we're putting a grant in to get one so we can do it in the lab. I can in like 5 minutes tell you what your blood cholesterol levels are. It's helpful if you've not just eaten a meal and some other things, but I can tell you pretty quickly. But most people don't know. So that should raise a question, Dr. Black. What do we do if we don't know? Okay? The easy answer is, if we don't know that answer, count it as a risk factor. Okay? Count it as a risk factor. What we tend to do with this is, if we don't know this, okay, but the person isn't sedentary and they aren't obese, then we don't count it as a risk factor. You're probably not going to be there. Okay? Same thing with fasting blood glucose. If you have a wake up in the morning fasting blood glucose that is over 100 milligrams per deciliter, but under 126, then you're considered pre-diabetic. If you're over 126, you're considered diabetic. Okay, if you're under 100, that's normal. Okay? Anybody have any idea what your fasting blood glucose is? Of course you don't. Why would you ever need to measure it? Okay? And we know now this isn't even the best way, this isn't even the best thing to try to look at if we want to diagnose you with diabetes. We want to look at hemoglobin A1C levels as well. Okay? So, same thing. If we don't know your fasting blood glucose, if you are obese or you are sedentary, we're going to count it as a risk factor. If we don't know, but you're not obese by BMI and you're not sedentary, then we're going to not count it as a risk factor. Okay? So 7 questions. We add up how many yeses and how many nos. Okay? You're allowed 1 yes. Okay? 1 or 0 yeses, and you're considered low risk. Okay? Good for you. We can do any kind of exercise we want today. Your chances of having cardiac arrest during exercise are infinitesimally small. If you have 2 risk factors or all 7, it doesn't matter. 2 to 7, you're considered a moderate risk. A moderate risk. And we treat you just like we would if you had passed the PAR-Q, or if you were over like 45 or older, or 55 or older. If you're moderate risk, you can do light and moderate intensity activities with no physician's clearance. For vigorous, you need physician's clearance. Okay? All right, you guys follow me generally for all of that. Okay? Because we're about to put it in practice and we'll see. Okay? Go.
What is this called again?
This is called, this is the cardiovascular disease risk screening. These are risk factors for cardiovascular disease.
And then how, like, okay, I know that you said we need to know this for the test, but like for the pre-diabetic, like, do we need to literally know word for word, or is there some?
Yes. You need to know that if it's over 100, but less than 126, you're pre-diabetic. That's what
Okay, that's what I was wondering. Or do I need to know all the millimoles per liter and all that crap?
I mean, the units are what they are. I really want you to know the value so that if you saw it in something like what I'm about to show you guys, you could pick out whether or not the person had it. Okay. So what we're going to do now is I'm going to give you guys, for those of you that loved it probably in junior high, I'm going to give you word problems. I'm going to give you a paragraph of information that has been sort of obtained or made up about a theoretical person. And you are going to use what you know about what makes somebody high risk, moderate risk, or low risk to decide, are they high or moderate or low. Okay? So I want you to do this with a partner or a couple of partners. Okay? For my Zoom folks, I'm going to make, there are 17 of you guys, I'm going to make 6 breakout rooms, and I'll put you guys into those breakout rooms. Okay? So what I'm going to do is we're going to go, let's just walk you through those kinds of things. All right. we're going to do this case study. All right. So I want to do breakout rooms. All right. So I'm opening the breakout rooms. You guys go into the breakout rooms. When you have what you think your answer is, come back, okay, and post in the chat. All I want is high risk, moderate risk, low risk, go. Get this out of y'all's face. Kelly, Zach, y'all are okay? You want to work by yourselves? It's fine.
Oh, I just was reading the thing, I didn't realize.
No, it's fine. Y'all can work by yourselves. I don't care. I just want, you know.
Oh, okay.
Okay.
Is there a way that you can move that thing out of the way?
It's the best I can do.
Yeah, that's good.
Okay. All right. No. You don't have to email it to me yet. Just write it down. We're going to do a couple, and then you guys can email that to me, and that will be what our sort of grade for in class today. Okay? You guys are ready? Yes? You don't sound very convinced. I know. You think you're ready. Kelly, are you ready?
Yes.
Kelly's ready. Zach? Yeah? Okay. Okay, y'all are good. Okay, Hallie, Lily, what are y'all ready or no? Y'all are ready. Okay. Seems to be no one. The breakout rooms are still doing things. You want to jump to the breakout room and see what they're doing? Are you all actually like doing your own work? Okay. Here we go. I probably should pause the recording on all that. So, one group is coming back. That's good. We'll give them just another couple of minutes.